Good afternoon and welcome. I am Michelle Fedrick, joined by my colleague Stephanie Sutton, and today's session is covering the NHSN Antimicrobial Use and Resistance, also known as the AUR module reporting for the CMS Promoting Interoperability Program. By the end of this session, you will be able to describe and report on the mechanisms for reporting, outline the steps for meeting the AUR measure within the CMS Promoting Interoperability Program for calendar year 2025, and summarize answers to common questions. As a disclaimer, slides and answers are based on details in the Federal Register and can be found at the link on the screen, as well as the CMS published fact sheet containing calendar year 2025 Promoting Interoperability Program updates, which can also be found at the link on the screen. I will now hand it over to my colleague, Stephanie.
Thanks so much, Michelle. So I'll start with the first question. So question 1, what is the Medicare Promoting Interoperability Program? Next slide, please. As a quick overview, the Medicare Promoting Interoperability, or PI program, requires eligible hospitals and critical access hospitals to report on objectives and measures to be considered a meaningful electronic health record, or EHR user, and to avoid a downward payment adjustment. This slide shows the scoring table for objectives and measures for this year, which is calendar year 2025. You can see that many of the measures included in this program, your hospital is likely reporting many other measures in addition to AUR reporting as part of participating in the PI program. Next slide, please. In this slide, I would like to highlight that CMS split the AUR surveillance measure into two separate measures. In calendar year 2025, hospitals and critical access hospitals must be in active engagement or claim an eligible exclusion for each measure. Both AU and AR are still required measures for the calendar year 2025 PI program. Because they are separated, hospitals can be at different levels of active engagement for each measure. So with AU surveillance and AR surveillance, since they are considered new measures for calendar year 2025, facilities do have an extra year for option 1. Next slide, please. All right, so you are at your first knowledge check. So true or false? Starting in 2025, the AUR surveillance measure has been split into two separate measures, AU surveillance and AR surveillance. You can say A for true or B for false. Give you guys a few seconds to think, and then we'll advance to the next slide. All right, next slide, please. And if you answer true, you are correct. As stated previously, CMS split the AUR surveillance measure into two separate measures. Next slide, please. What does active engagement mean? Next slide, please. As you all know, there are two ways to be in active engagement with NHSN. Option 1 is pre-production and validation. This includes completing the registration of intent within NHSN and working with your vendor to produce AUR test files for validation. If the facility is working towards generating test files, CMS has confirmed that the test file step is not required to be completed to count towards active engagement. Or the facility can be in option 2, which is validated data production. And that means they also have completed their registration of intent within NHSN, and they are moving forward with sending production AUR data to NHSN. For calendar year 2025, It is 180 continuous days of AUR data submission, which is also known as the EHR reporting period. And we'll discuss the EHR reporting period in a few slides. And I just want to make a quick note. Definitions of active engagement are set within the PI program and are the same for other public health and clinical data exchange objective PI program measures. Next slide, please. As mentioned previously, CMS has split the AUR surveillance measures into two separate measures, so AU and AR. In calendar year 2025, hospitals and critical access hospitals must be in active engagement or claim an eligible exclusion for each measure. Both AU and AR are still required measures for the calendar year 2025 PI program, but because they are separated, hospitals can be at different levels of active engagement for each measure. So on this slide, I have a couple of examples. Let's walk through those examples. So example one, let's say a hospital is reporting production AU data to NHSN, but is still working on setting up their AR data feeds or working on some internal mapping for the AR data. This hospital can attest to option 2, so sending production data for AU surveillance, and option 1, registration and testing for AR surveillance. And in example 2, let's say a hospital is working on validating their AU data with their software vendor, but do not have the necessary data for the AR reporting in discrete fields within their EHR. This hospital can attest to option 1, which is again, registration and testing for AU surveillance, and claim an exclusion for AR surveillance due to the lack of access to the discrete data elements. Next slide, please. Now we have another knowledge check. So this question asks, how many ways can your facility be in active engagement with NHSN? Is it A1, B2, C3, or D4? I give you guys a few seconds to think about it, answer the question, and then I'll advance my slides. Okay, next slide, please. And if you answer B2, that is correct. There are only 2 ways to be in active engagement with NHSN. Option 1, which is pre-production and validation, and option 2, validated data production. Next slide, please. Are patient level data collected and or shared? Next slide, please. The answer to that is yes and no. With AU, no patient level data is shared, and with AR, yes, patient level data is shared. So with AU, no patient level data is shared with NHSN. Antimicrobial days are aggregated to the month and location, aka the unit level, and the facility-wide inpatient level, aka FAQs. So we do not get any patient level data collected. With AR, yes, patient level data is shared with NHSN. The AR event is isolate level susceptibility results for specific organisms reported for all inpatient locations and 3 outpatient location types. So your emergency department, your pediatric emergency department, and your 24-hour observation. AR events must meet the qualifying criteria outlined in the protocol. And for additional information on the AUR protocol and any trainings associated with it, you can visit the AUR homepage from the link on the screen. Next slide, please. What specific files must be submitted? Next slide, please. The following files must be submitted. To submit AUR data, there are 3 different types of files. We have 1 AU file and 2 AR files. The antimicrobial use file includes days present, admissions, and antimicrobial days. The AR event data included the AR event data includes the isolate level susceptibility results for specific organisms and an antimicrobial resistant file, which includes AR data, patient days, admissions, and encounters. Next slide, please. So what is the reporting period for the CMS Promoting Interoperability Program? And do I need to be reporting AUR data into NHSN now? Next slide, please. For calendar year 2025, it is 180 continuous days. NHSN cannot tell you what your reporting period is. Each facility designates their own EHR reporting period, and the facility must use the same reporting period for all CMS program measures. AU and AR data must be reported for the same 180 days. Some examples of this reporting period are January 1st to June 30th, April 1st to September 30th, July 1st to December 31st. It can really be any 180 continuous days, but it has to be set by your facility. Next slide, please. How can NHSN users find out about their facility's EHR reporting period? Next slide, please. Again, it's designated by each facility. Remembering that the reporting period is designated by each facility, if you are unsure what the reporting period is, it is recommended to reach out to persons in charge of quality reporting within the facility or the C-suite. Specifically, you may want to check with the individuals who have access to the CMS Hospital Quality Reporting, what we know as HQR system. Next slide, please. What hospital software systems should these data come from? Next slide, please. AUR data comes from electronic sources only. AU data from electronic medication administration records, or EMAR, or barcoding medication administration, which is also called BCMA, and admission discharge transfer system. So that is our ADT systems. AR data is from the Laboratory Information System, or the LIS, or the EHR, and the admission, discharge, and transfer systems. And it's very important, in fact, the most important thing to know, that there is no manual data collection or entry into NHSN for AUR. Next slide, please. Okay, we've reached another knowledge check. So again, true or false? Manual data collection and entry are allowed in NHSN for AUR. Next slide, please. And if you answer false, you are correct. Manual data collection and entry are not allowed in NHSN for AUR. Next slide, please. So, what are the exclusions for AU and AR measures for 2025? And have the measures changed from 2024? Next slide, please. Yes, the measures have changed since 2024. Let's walk through the calendar year 2025 exclusions. Remembering the measures have been separated. So since the measures have been separated, the exclusions are now specific to each individual measure. First are the exclusions for the AU surveillance measures. The first exclusion listed here is the same as calendar year 2024. You do not have any patients in any patient care location for which data are collected by NHSN during the reported period. The second exclusion is also the same as calendar year 2024. Do not have a EMAR or BCMA electronic records or an electronic ADT system during the reporting period. And then we have a third exclusion, and this exclusion is actually new. You do not have a data source containing the minimal discrete data elements that are required for reporting. This exclusion may be more pertinent to AR data, and we haven't heard too much from hospitals planning to claim an exclusion for AU. Next slide, please. Now we'll cover the AR surveillance measure exclusions. Again, the first exclusion is the same as calendar year 2024. The facility does not have any patients in any patient care location for which data are collected by the NHSN during the reported period. Likewise, the second exclusion is also the same. Does not have an electronic LIS or electronic ADT system during the reporting period. This last exclusion is new. Does not have a data source containing the minimal discrete data elements that are required for reporting. We've heard from many hospitals this year experiencing this scenario. As an example, they may send isolates out to an external lab for identification and/or susceptibility testing. The results may be returned to the facility in the form of a fax or a PDF. And in this case, the facility doesn't have interoperable use of those results, and they will qualify for this AR exclusion. Next slide, please. So here are some exclusion examples for calendar year 2025. So let's walk through some of them. In the first example, the candidate isolates are sent out for identification and/or susceptibility testing and returned to the facility via PDF or fax. In this case, the hospital does not have interoperable data and they should claim an exclusion. In my second example, the hospital's candidate isolates cannot be speciated. Based on changes being made to the AR option reporting requirements for 2025, specifically the addition of Candida genus as an eligible organism, the facility can report their isolates as Candida genus and therefore do not need to claim an exclusion. And lastly, in the third example, the hospital's Candida isolates are speciated but do not have susceptibility testing performed. Again, based on the changes to the AR option reporting requirements, the reporting requirements, specifically the change to allow Candida isolates without susceptibility results to be reported, these isolates are eligible for reporting, and this hospital doesn't need to claim an exclusion. Next slide, please. Remember, since the measures have been separated for calendar year 2025, your hospital must meet either the active engagement criteria or have an eligible exclusion for each measure separately. For example, a hospital's inpatient units were closed for construction. The hospital can claim an exclusion 1 for both the AU and the AR surveillance measures. So you must have an exclusion for each measure separately. In my second example, a hospital does not receive susceptibility results from their external lab in discrete fields. In this case, the hospital can claim an exclusion 3 for the AR surveillance measure, but they need to be in active engagement to report AU data into NHSN since they don't have an eligible exclusion for AU data. Next slide, please. My laboratory suppresses some susceptibility test results. Does this count as an exclusion? And can I still submit AR surveillance measure data if I am unable to send suppressed susceptibility results? Next slide, please. Data suppression is not an exclusion. So no, data suppression does not count as an eligible exclusion for the AUR surveillance measure for the EHR reporting period or the AR surveillance measure for the EHR reporting period in 2025. In your eligible hospital, if your eligible hospital or critical access hospital cannot obtain and/or send suppressed data to the NHSN AR option, NHSN will accept the data your eligible hospital or CAH is able to provide. Please be sure that your AUR reporting software vendor is using not tested for the unavailable tests and drugs. The NHSN application will not accept AR Event Clinical Document Architecture or CDA files that do not contain all the required drugs for a given organism. Next slide, please. Question 10. We send specimens to an external lab and they send results back via fax or PDF. Does our hospital qualify for an exclusion? Next slide, please. Yes, facilities without discrete data meet exclusion criteria. Many eligible hospitals and critical access hospitals use outside labs for some, most, or even all susceptibility testing. We also know that in some cases, these results might not make it into the hospital's LIS. At the same time, NHSN has minimum results requirements. A hospital may qualify for an exclusion in a rare instance where the following conditions are met. They do not have an LIS for non-microbiology data, so things like hematology or chemistry results, but they don't have an LIS for microbiology data. Or the AR data for submission to NHSN are not available as discrete fields in the LIS. For example, results for the Canada species identification and/or susceptibility testing are faxed and scanned into the patient record as a PDF. And it's also important to note for calendar year 2025, Canada isolates without susceptibility testing results will become eligible for the AR option reporting. Therefore, eligible hospitals and critical access hospitals that do not perform susceptibility testing on Canada isolates or are unable to access discrete susceptibility results for Canada isolates will no longer qualify for an exclusion for the EHR reporting period in 2025. Next slide, please. For the EHR reporting period in 2025, will eligible hospitals and critical access hospitals be expected to separately attest to meeting the reporting requirements or exclusion criteria for the AU and AR surveillance measures? Next slide, please. Yes, in 2025, facilities will separately attest. Eligible hospitals and critical access hospitals must report a yes response to being in active engagement. So that is option 1 or option 2. And eligible hospitals and critical access hospitals that claim an applicable exclusion for only AU or AR would either need to be in active engagement for the other measure or claim a separate exclusion. Eligible hospitals and critical access hospitals that report a no response to either measure, fail to report any response, or fail to claim an applicable exclusion will not receive credit for the measures. These eligible hospitals and critical access hospitals will then fail to satisfy the requirements of the public health and clinical data exchange objective, and they will earn a score of a 0 for the Medicare Promoting Interoperability Program. Next slide, please. So how are these data submitted to NHSN? Next slide, please. The data are submitted by Clinical Document Architecture, or CDA files. For the AUR module, the data is actually required to come in this way. The data is just too much to be entered by hand. CDA is a Health Level 7 or HL7 standard, and it provides a way for facilities to standardize and upload their data into NHSN. We use it in AU and AR, and some facilities use it to upload their HI data also. It's important to know that CDA is not the same as CSV. CDA uses extensible markup language, which we also call XML, and the screenshot on the slide is just a tiny portion of an AU CDA file. Looking at this screenshot could make you very confused as it requires a very in-depth knowledge of XML coding as well as HL7 structuring. And also when you submit your data into NHSN, you have to have your SAMS credentials to get into NHSN. And lastly, know that CDA does not equal CSV. Next slide, please. This is why we recommend using a vendor, because it's so much information. The vast majority of facilities use a commercial vendor, but it It could be either that or an EHR vendor or a surveillance vendor software. But as required for the PI program, you have to use a certified electronic health record technology or CERT that has been updated to meet the 2015 Education Cures update, specifically the Office of the National Coordinator for Health Information Technology, so ONC certified. Additionally, vendors have to meet NHSN validation standards, and we have all the vendors that have passed on the validation linked here. We have our AU vendors linked at that first hyperlink and our AR vendors linked at the second hyperlink. Next slide, please. And now I will turn it over to my colleague, Michelle.
Thank you, Stephanie. What do facilities need to do to meet the AU and/or AR reporting piece of the CMS Promoting Interoperability Program? For calendar year 2025, facilities need to do the following. First, complete the registration of intent. If your hospital already registered intent in any previous calendar year, no further registration is needed. If registration is not already completed, this process can only be completed by the NHSN facility administrator and only completed one time ever and cannot be undone. Please note that there is no way to register for only AU or only AR. As of January 2025, this single registration allows your hospital to register intent for both the AU surveillance and/or AR surveillance measures. Next, you will send AU and/or AR test files for validation. If your hospital already sent test files in any previous calendar year, no further test files are needed. If test files have not been provided, once the registration is finalized, an email will be sent to the facility administrator to kick off the testing and validation step to send either AU-only test files or AR-only test files, or both AU and AR test files. In further detail, to attest to active engagement for the AU surveillance measure only, send one test file, and that would be the antimicrobial use summary CDA file. To attest to active engagement for the AR surveillance measure only, send two test files. That includes the antimicrobial resistance numerator CDA, also known as the AR event, and the antimicrobial resistance denominator CDA, also known as the AR summary files. To attest to active engagement for both the AU and AR surveillance measure, you'll send all three test files. That includes the AU summary CDA, the AR numerator CDA, also known as the AR event, and AR resistance denominator CDA, also known as the AR summary. Lastly, send production AU and/or AR data to NHSN. If your hospital is already sending production AU and/or AR data, continue sending production AU and/or AR data to NHSN monthly. NHSN will automatically email the NHSN facility administrator and optional email contacts a monthly report outlining your data submission status. Same deadlines apply in calendar year 2025. For registration, if not already completed, registration of intent must be completed within 60 days of the start of your EHR reporting period. For test files, if not already completed, reply to the NHSN's request for test files within 60 days of the request. If test files are not yet ready when NHSN requests them, reply with a status update. No further status updates are needed after that. If your hospital would like an official letter from NHSN with your testing results in calendar year 2025, send files no later than November 1st, 2025. For production data, Report AU and/or AR data on an ongoing basis during your EHR reporting period. On February 1st of each year, the NHSN facility administrator and optional facility PI program contacts will receive an automated email with an annual report summarizing the submission of AU and/or AR data to NHSN for the previous calendar year. Facilities should be sure to save these emails for their records. This letter should be retained on site, but does not get submitted to CMS unless requested. Do I need to add AUR to my monthly reporting plan in NHSN? If so, how? Facilities must add AU and/or AR to the monthly reporting plan when ready to submit production AU and/or AR data. For AU reporting, add facility-wide inpatient, also known as fact-wide in, and add each individual inpatient location and select eligible outpatient locations. For AR reporting, add facility-wide inpatient, also known as fact-wide in, and also add select eligible outpatient locations. NHSN strongly encourages the submission of data from all NHSN-defined inpatient locations, including procedural areas like operating rooms, facility-wide inpatient, also known as fact-wide in, and select outpatient acute care settings, specifically outpatient emergency department, pediatric emergency department, and 24-hour observation area from which the numerator and denominator data can be accurately captured. The screenshot is a sample of what the monthly reporting plan looks like for AUR with these selected locations. I can see AUR items showing up on the missing data alerts when I log into NHSN, but I've uploaded my AUR data and the monthly AUR submission status report emailed to me shows yes for all reporting. Why is there a discrepancy? Let's now discuss the monthly reporting plan and alerts. Facilities add AU and/or AR to their monthly reporting plans. They then upload AU and/or AR data. They will also need to ensure that all locations listed in the monthly reporting plan are included in the upload. If yes, no missing summary data alerts are generated. If no, missing summary data alerts are generated. Please note that if a file has been uploaded for all locations that have been included in the monthly reporting plan, there should not be any missing data alerts generated. However, if one or more of the files for a given location included in the monthly reporting plan have not been uploaded, missing summary data alerts will be generated. The image on the screen depicts how missing summary data alerts appear within NHSN and will be located under the Missing Summary Data tab. The Missing Summary Data alert will include the month and year, the location, alert type, and data type, either AU or AR. You can clear alerts by uploading data. Missing summary data alerts can be cleared by uploading the missing data. You may ask the question, why do I have missing data? This could be due to the zip file not including all location types or data types, or individual files may have failed and you did not notice during the upload process. We recommend that you try the upload again and pay close attention to the number of files in the zip and whether any of them fail. We also recommend that you work with your vendor representative so that you can find the missing files and resolve the errors in the files. Once your vendor representative has made the corrections, you can try the upload again. And remember, the goal is to have 0 missing data alerts. We've reached knowledge check number 4, true or false. When facilities add AU and/or AR to their NHSN monthly reporting plans and upload AU and/or AR data, if not all locations listed in the monthly reporting plan are included in the upload, missing summary data alerts will be generated. The correct answer is true. When facilities add AU and AR to their NHSN monthly reporting plans and upload the AU and AR data, it is essential that all locations listed in the monthly reporting plan are included in the upload. If all locations are included in the upload, no missing summary data alerts are generated. However, if some locations are not included, missing summary data alerts will be generated. Now I will discuss alerts for missing AR event data. Make sure you have isolates that qualify as AR events. Due to the broad eligibility criteria for what counts as an AR event, most facilities will have AR events to report each month. If you do have isolates that qualify for AR events, find those files within your vendor software and upload them. If you do not have isolates that qualify for AR events, click Port No Events box under the Missing Events tab as indicated on the image. Clicking this box tells NHSN that your hospital had a true zero for AR events for that month. To learn more about how to report no AR events, refer to the link on the screen. This document reviews the process of reporting no antimicrobial resistant events and reviewing the AR option summary line list to confirm reporting. You can also clear missing AR event data alerts by updating the monthly reporting plan. In some circumstances, you may not be able to report data for a location in your reporting plan. For example, that location may not be able to accurately capture numerator or denominator data. If that is the case, you can remove that location from the reporting plan. To do so, you will simply click garbage can icon on the reporting plan to remove that location. And for more information on clearing alerts by updating the monthly reporting plan, please see our extensive AU FAQs that can be found at the link on the screen. If a hospital uses a validated vendor, does that change the requirements? No, using a validated vendor does not change the requirements. If attesting to option 1, which is pre-production and validation, and the hospital would like a letter from NHSN denoting the validation stage is complete, send relevant test files regardless of the vendor used to submit AU and/or AR data. If attesting to option 2, validated data production, you do not need to send test files for validation. I will now discuss the 3 types of validation. The first is data quality validation, which is conducted by the individual facility or system. This type validates that the data are accurate and complete, such as antimicrobial days, and do not need to share results with NHSN AUR team. The second is the CDA file validation. This is part of the CMS PI program process, and this type validates that CDA files pass NHSN's business rules, such as correct drugs in the file, and all required fields are included. The third is vendor software validation. NHSN validation, also known as synthetic dataset or SDS validation, validates vendor software can correctly apply rules of the AUR protocol. It's required for all vendors, and please refer to the link for more information. We recommend that you visit this link in order to find out specific information regarding the synthetic dataset validation. Also, ONC certification. Its validated vendor software can generate CDA files that meet format requirements. This is also required for all vendors. And for more information on ONC certification, we ask that you please visit the link on the screen. My hospital is already submitting production AU and/or AR data to NHSN. Do we need to submit an AU and/or AR files for testing and validation? The answer is no. Validation file submission is not required for eligible hospitals and critical access hospitals. Eligible hospitals and critical access hospitals are not required to submit files for validation during the EHR reporting period. They can attest yes to option one, pre-production and validation, if they are working towards the creation of AUR files within the EHR reporting period. If an eligible hospital or critical access hospital would like an official letter from NHSN showing that the testing and validation step is complete, then yes, they should email the relevant files, AU, AR event, and/or AR summary according to the measure they plan to attest to. More about the request for test files. If your hospital intends to attest to option two, validated data production, you can disregard these emails. However, if attesting to option one, pre-production and validation, we ask that you respond to the request for test files within 30 days, indicating you registered before having your test files ready. Failure to respond to either the first or second request for test files within an EHR reporting period will result in that eligible hospital or critical access hospital not meeting minimal measure requirements and earning a total score of 0 for the Medicare Promoting Interoperability Program. Let's say you don't have any test files ready. Well, as a reminder, if the eligible hospital or critical access hospital replies one time within 60 days, no further updates are needed until the test files are ready for validation. When do facilities need to register and send test files to attest to option one, pre-production and validation for calendar year 2025? Well, the timing varies. Registration should be completed within 60 days of the start of the EHR reporting period. After registering, NHSN immediately sends a request for test files. Facilities should respond to NHSN's request with test files or a status update within 30 days. We ask that facilities submit test files no later than November 1st. This allows the NHSN team to process the test files. Here's an example timeline for option one. For facility A with a designated 180-day EHR reporting period from March 1st to August 31st, the timeline for submitting AUR data begins with registering intent to submit within NHSN by April 30th. According to CMS specifications, this registration must be completed within 60 days from the start of EHR reporting period. To receive a letter back from NHSN showing passing validation, the facility must submit test files no later than November 1st. However, test files should be submitted as soon as they are ready, and there is no need to wait until November 1st. If the hospital receives a response from NHSN within 60 days, no additional updates will be required until the test files are ready for validation. When do facilities need to report AU and/or AR data to attest to option two, validated data production for calendar year 2025? No later than January 31st, 2026. Data should be reported monthly during the EHR reporting period. NHSN automatically sends out status letters on the first day of every month, as shown with the image on the screen. Final annual summary letters are sent out on February 1st, showing the previous year's submissions. We ask that you submit all relevant AU and AR data to NHSN no later than January 31st, 2026 to be included on the annual report sent to facilities on February 1st. This documentation is sent to the NHSN facility administrator and any optional PI program contacts. Here's an example timeline for option 2. For Facility B with a designated 180-day EHR reporting period from July 1st to December 31st, the timeline for submitted AUR data begins with registering intent to submit within NHSN by August 31st. According to CMS specifications, this registration must be completed within 60 days from the start of the EHR reporting period. Throughout the reporting period, Facility B must report production AU and/or AR data to NHSN on an ongoing basis. NHSN recommends submitting the data for each month within 30 days of the month's completion. Finally, ensure that the December 2025 AUR data is submitted by January 31st, 2026. We've reached knowledge check number 5. When must all relevant calendar year 2025 AU and AR data be submitted to NHSN to be included in the annual report sent to facilities? Is it A, December 31st, 2025, B, January 1st, 2026, C, January 31st, 2026, or D, February 1st, 2026? The correct answer is C, January 31st, 2026. Remember, all relevant calendar year 2025 AU and AR data must be submitted to NHSN by January 31st, 2026 to be included in the annual report sent to facilities on February 1st, 2026. Do the quarterly CMS quality reporting program deadlines apply to a UR module reporting for the CMS Promoting Interoperability Program? No, those are two separate CMS programs. AUR measure within the CMS PI program does not have quarterly deadlines. AUR reporting is completed on an ongoing basis. Facilities attest within the CMS HQR system once a year, and that is due on the last day in February. We have included a link to the CMS Hospital Quality Reporting, also known as the HQR system website, at the bottom of this screen. What's the penalty for failure to report AU and/or AR data for 2024 and subsequent years? Eligible hospitals and critical access hospitals must report a yes response or claim in applicable exclusion. Failure to fulfill any of the required measures, including the AU and/or AR surveillance measures, will result in a score of 0 for the Medicare Promoting Interoperability Program. In such cases, the eligible hospital or critical access hospital would not be considered a meaningful user of the certified electronic health record technology and would be subject to a downward payment adjustment. Critical access hospitals will receive a downward Medicare payment adjustment from 101% of reasonable costs to 100%. Eligible hospitals will receive a reduction of 75% of their annual market basket update. Exclusions from measures and options for hardship exceptions also exist. Does CDC or NHSN provide data to CMS? The answer is no. AU and AR measures are attestation based. CDC and NHSN does not provide any data to CMS for these reporting measures. The goal of the CMS PI program is to increase interoperable healthcare data exchange. Facilities must attest to CMS that they are in active engagement with NHSN. Facilities must attest within the CMS Hospital Quality Reporting System, which can be found at the link on the screen. And NHSN does not provide documentation to facilities to use as proof. When and where do facilities complete the CMS Promoting Interoperability Program attestations? Again, as previously stated, facilities must attest within the CMS HQR system. Facilities attest within the CMS HQR system once a year for the previous year. Example, you would submit attestations for calendar year 2025 by March 14th, 2026. Note, this date is subject to change due to weekends, federal holidays, or other changes proposed and finalized in CMS regulations. Date changes are also communicated by CMS. All CMS PI program measures are included in the attestation process. Review the CMS PI program resource library for more information at the following link that is provided on the screen. Where and how do facilities get documentation of active engagement status? For option 1, documentation and verification of facility status, keep in mind, regardless of which option your facility is attesting to, all facilities receive an automated request for test files. Specifically regarding option 1, pre-production and validation, the first email sent indicates that you've successfully registered and request to send test files. This is sent to the NHSN facility administrator and any optional PI program users. The second email indicates that your test files have passed validation. This is also sent to the NHSN facility administrator and any optional PI program users. Please note, this is only sent after one AU file or two AR files, AR event and AR summary, are validated by NHSN. For option 2, validated and data production, the following documentation will be provided. A monthly email will be provided showing AU and/or AR data submission status. This is sent to the NHSN facility administrator and the two optional PI program users listed. This status report is generated on the first day of each month and reflects the status of data submitted from the previous month. For example, the PI program report that will be sent out, let's say July 1st, 2025, shows the status of data submitted through May 2025. The annual PI program report is generated by February 1st of each year. Ad hoc letters can also be generated at any time by the facility administrator only, and this information is available and provided at the link on the screen. We've reached our final knowledge check, number 6. True or false? CDC and NHSN provides data to CMS for AU and AR reporting measures. The correct answer is B, false. CDC and NHSN does not provide any data to CMS for these reporting measures. Facilities must attest to CMS that they are in active engagement with NHSN via the CMS HQR system, and NHSN provides documentation to facilities as proof. Before concluding, I'd like to point out some important resources for the AUR module. We ask that you bookmark the AUR module webpage by using the link on the screen. You can also review the protocol and listen and watch our AUR training webinars. For PI-specific AUR module resources, review the NHSN CMS requirements at the link provided on the screen, including the most up-to-date AUR module-specific trainings as shown on the screen. For questions related to the Promoting Interoperability Program requirements, please reach out to CMS subject matter experts using the QualityNet question and answer tool available on qualitynet.cms.gov website. To access the tool, click on the Help tab in the upper right-hand corner, then select Question and Answer Tool main page. Then select Ask a Question. From there, choose PI, Promoting Interoperability, from the Program drop-down menu. You may also contact CMS Live Support Center Help Desk at 844-472-4477. For NHSN questions or concerns related to the annual training, you can post any questions in the annual training community. After June 10th, please submit questions to the NHSN Help Desk. You can access the new portal at the link provided on the screen. And if you do not have a SAMS login or are unable to access ServiceNow, you can still email the NHSN Help Desk at nhsn@cdc.gov. That concludes our presentation on the AUR Module PI program. Thank you.